Hello, my name is Micaiah. I'm a registered dental assistant at Dr. Gorton Schmohl's office, and in this video, I'll be going through Invisalign instructions. So let's get started. So what we have given you guys is a white Invisalign box, which contains all your aligners with these bags inside. And your box may say 1 through 16, and you might have another one that says 16 through 30 out of 30. And so you would start off with a box that says 1 through 16. And then you will find number 1. And then you would rip the top. This one's already open because I'm on aligner number 8. But let's pretend I just ripped it open. And then you're going to open up the bag. And then I'll grab my aligner. Before you put your aligners in, you're going to wash your hands really well. And then take your aligners out of the first bag. And then you'll find a top aligner and a lower one. So just think of it as big teeth go up top and little teeth go on the bottom. All your aligners, like I said, have bags that are numbered, but they also have numbers on the aligners themselves. So if you ever forget which number you're on, you can just take them out and look in the very back. I'll give you guys another view in a second. So this says U08 as in upper 8. And then this one says L08 as in lower 8. So if you're ever like, what number am I on? You can just take them out. So to put your aligners on, you're going to use both your hands and line it up perfectly with your front teeth. So it's kind of like a puzzle. You match the pieces together. And you're not only going to want to push in the front, but all the way in the back too. Let's use our bottom. And you kind of want to hear those clicking noises. Those are good. So our fingers aren't strong enough to seat our aligners all the way down. So what you'll be using is something called chewies. And you'll do exactly what they're called. You'll chew on them. And so 2 comes in a packet. And you'll do this for as long as you want. And you really want to focus on the teeth in the very front, because those are the teeth that need the most help to seat all the way. When putting on your aligners, you might feel some resistance. If you do, when you put your aligners on, you can kind of roll them into place or put your aligners on one side at a time. For example, say this side didn't want to go on, or I had a tooth that was kind of tilted in, I would kind of have to roll it on. So I did one side at a time and I kind of rolled it in. If you do have any resistance, you might not. Removing your aligners is super important. You never want to pull from the front first. You always start in the back and work your way to the front. And what I like to do is use my index finger and use my fingernail. And I'll go from the inside and unlatch off one side and then do the other side. And once the big teeth in the back are released from the aligner, I'll work my way to the front like this. And the same thing on the bottom. Sometimes I use my thumb, but still using my fingernail. And just like that. And you're going to put your aligners in your case and close it. So we always recommend for you to have a chewy in your case at all times. So when you put your aligners back in, you're reminded to immediately use your chewy. So just when I put them back on, I'm going to use my chewy no matter what, every single time. Personally, in my first set of aligners, I have 17 in my set. So here are all my bags. And as you can see, I've kept every single aligner. So when I move on to one, I'll put the previous one back in the appropriate bag, just so I always have a backup plan. And we recommend for all our patients to do that. So let's say you're on aligner number 5 and you lost or broke it. Things happen, it's okay, but try not to. Then we would want you to move on to aligner number 6. But if number 6 was way too tight and your aligners weren't seating all the way up to your teeth, like if there's a big space, then we would want you to go back to number 4 and just wear that one for an added week until switching to 6. But let's say number 6 fit just fine, it was just really tight but doable, then you would be fine. Moving forward, you would just wear that one for another week as well. We basically always want you to move forward if possible, but if you can't, that's okay. You'll just go back and wear it for an added week. We'll be wearing your aligners for 20 to 22 hours a day. We recommend people don't have their aligners out of their mouth for longer than 30 minutes. So the only time they're out of your mouth is when you're eating food, drinking something other than water, and brushing your teeth. Even if you're drinking a clear Sprite, let's say, the sugar is really bad for the aligners, and we wouldn't want all that sugar to get stuck in between your teeth and plastic, because that could cause cavities. So only drink water with your aligners on. So after eating or drinking something other than water, you're going to want to brush your teeth really well after and brush your aligners as well. If you can't brush your teeth in the moment, that's okay. Just always have a water bottle with you to swish water around in your mouth. Wearing your aligners and having really good compliance is what is going to move your teeth. So try to be mindful and put them back in your mouth as soon as you can after eating or drinking something other than water and brushing your teeth. Let's say your switch day was every Wednesday, but during the week you maybe only wore your aligners for 16 hours one day instead of 20 to 22 hours. You would just make up for that day. So instead of switching that Wednesday, you would switch Thursday instead, so you make up for that day. So there's something called a holding period. We tell patients they can hold their aligners only at night if they're going to be traveling and they don't think they're going to be able to wear their aligners full time. So you would just hold it for nighttime only and not switch until you can wear them full time again. If you are a teenager, you are able to switch your aligners once a week with excellent compliance. If you are an adult, you can change your aligners weekly as long as you're using your Excelit device for 20 minutes. If you're not, then you will be switching every 2 weeks. For little kids, you can switch twice a week if you're using your Excelit. If you're not using Excelit, you'll be switching once a week. You want to treat your aligners like your own teeth. So when you wake up in the morning, you brush your teeth and your aligners with toothpaste and toothbrush. And then at night you would do the same, because aligners get really icky from being in your mouth all day long. Invisalign gives you little cleaning crystals. All you'll do is use warm water, not hot, and drop some crystals in the water and leave your aligners in there for about 15 minutes for a deep clean. You do not have to use this. As long as you're brushing your aligners every day, they should be fine, but everybody's mouth is different and may need a little more help to clean them, and that's okay. So now we'll go over your Excelit, which is a vibrating mouthpiece. It helps accelerate the process of tooth movement, and it helps with comfort. So we'll open it up. You might have to cut this little sticker to help open, and you'll see this. So this is added instructions on Excelit, and this is your case. So we'll take it out like this, and this is what it looks like. So what you'll do is push this button, and it'll fly open, and you'll take it out. So the case is not waterproof, but the mouthpiece is. So if you wanted to take a bath or a shower with it, it's okay, just don't get this case wet. So to turn it on, you would just push it like that and it'll turn blue. And it'll vibrate for 20 minutes. And at the 10-minute mark, it'll do a quick buzz letting you know you have 10 more minutes, and then it'll shut off completely when it's done. So you're gonna wanna have your aligners in your mouth when you do your Excelit. So let's do it again. I'll use your chewy. And so you can just lightly bite on it and relax your lips over it and go in at an angle. You can just relax like that. You don't have to hold it. You can just be hanging in your mouth. So you will use your Excelit every single day for 20 minutes. If you are a kid and this part pokes you in the back, you can just trim it with a scissor at home in the very back so it doesn't poke the back of your throat. After using your Excelit, you'll wash it really well with soap and water, and then you'll put it back in your case like that. Close it all the way, and to charge it, there is a unit in this little cubby. And what you'll do is use this part, put it into the back like that, and just plug it into an outlet, and that's how you charge it. If you have issues with your Excelit, if it randomly stops working or anything, just let us know and we'll help you out. Like I said, I do have 17 aligners in my first set. You may have 30, you may have 10. It kind of all depends on specific tooth movements and how many teeth we need to move. So if you have dogs or cats at home, this part is really important. Even if you don't have a dog, you should always keep your aligners in your case when they're not in your mouth. But this little guy, I left my aligners out once and I saw him running around the house with them. So just be really careful because they love the smell of our saliva and they will break them or eat them. So just be careful. I hope this video helped you guys. If you have any questions, please don't hesitate to email me. My email is rda3@marinortho.com, or you can text our number online. Thank you.